My name is Katie Briggs, and I'm going to go over environmental and cultural factors that can influence or affect veterans. First of all, just a little overview about some of the major health concerns for veterans. They primarily have health concerns in mental health and behavioral disorders such as PTSD, depression, anxiety, suicidal thoughts, ideations. They also struggle with substance abuse, most often seen with alcohol or smoking. Homelessness can be an issue with veterans. Traumatic brain injuries is common among veterans. Chronic pain, amputations, and hazardous exposure. Now we're going to go over some of the cultural environment that can influence veterans and their care. First of all, the media portrays veterans usually as one of two things, either the hero or a victim, a health victim. A study was done on the news coverage of veterans during Veterans Day over the course of several years, and this is kind of what they decided. The veterans are heroes because of what they give up in order to serve their country and to help protect lives. But they're also a victim because of all the health concerns that they come home with because of their service. And personally, in media that I viewed, such TV and movies, you see the same sort of portrayal. They're either seen as heroes or victims. I think in recent media, you especially see them portrayed oftentimes as victims, simply because there's an increased notice of the health concerns that veterans suffer with, and we're trying to draw attention to those health concerns and get more focus and care for veterans after they return. Other factors that influence veterans is whether or not they have family support. A study found that those with family support have better health outcomes, improved adherence to treatment, and usually improved function. The study did mention, though, that veteran service does affect their families. It can lead to changes in relationships. It affects children. They have a new normal that they have to adjust to because of their families' new health concerns and mental status when they return from deployment, especially. The study was specifically speaking about the families that had been deployed, and they also have to find new ways to cope and adjust to those concerns. Peers play a big role in the health of veterans. They have started institutionalizing, have started support groups for veterans that suffer with similar health concerns, like a support group for PTSD, a support group for substance abuse, a support group for traumatic brain injuries, and they have found that those support of your peers reduces symptoms, it decreases hospitalizations, and improves the function of veterans. And they especially found that this is peer support is very helpful for mental health and behavioral disorders. So in general, both family support and the role of peers has a very positive effect on veterans' health. Kind of want to talk about the cyclic natures of veterans' health concerns. So physical disabilities that they receive because of their service are kind of lifelong. That's something they're going to have to deal with and adjust to coming home. But a lot of the other things that they struggle with, like PTSD or other mental and behavioral disorders or substance abuse, can be cyclic in nature, and it's constantly something they're having to struggle against or work against or have treatment for and make sure those aren't out of control in their lives. I did find a study that studied the children of Vietnam veterans in Australia, and it found that veterans' children can have increased mental health challenges such as anxiety, depression, and higher rates of suicidal ideation than children of non-veterans. The legal and political system is doing its best to help veterans, actually. Starting in like the mid-2000s, they've started veteran treatment courts that instead of punishing veterans for criminal behaviors, they're trying to put them into treatment programs, so treatment for anger management or PTSD treatments to help solve the problem and the reason for the criminal behavior that's usually related to their health concerns from their service. Kind of politically, there's a big move to help veterans and support programs. Federal and state benefits are many for veterans. Here in Utah, they have extra tuition bills. There's a veteran hiring priority, so veterans are hired over non-veterans. They get reduced bus fares, reduced prices for fishing licenses in state parks. There's pro bono legal assistance in Utah. There's VA legal assistance. There's the VA hospitals that are funded federally, clinics and facilities. And they get the GI Bill. There's a lot of benefits for veterans that they can take advantage of to help their reintegration back into civilian life and to help address the health concerns they might have received because of their service. Potential barriers for veterans include leaving behind military culture. So that military culture has strong military values. They usually is very supportive of masculine behaviors and allegiance to command. I took a study that was specifically talking about student veterans, so the culture of military culture transitioning to a student culture was very much the opposite of the military, where the student culture is independent thinking, very loose values, don't follow commands. So it's very different, and it's very difficult to kind of make that transition. But I think it's very similar for just general civilian life. It's very different from military life. And having to kind of transition back into the culture can be difficult. It's a big culture shock. So that's a barrier for veterans. Also, another big barrier is veterans believe that what they're experiencing, such as PTSD symptoms or other mental health disorders, or even traumatic brain injury, sometimes can go untreated because they just assume that what they're experiencing is normal and just endure it instead of seeking treatment. So they don't seek treatment. So a lot of these issues can go untreated. Another big issue, even if they recognize that they need to be treated, is the stigma against receiving help for mental health disorders. And I think that's even stronger among military because of their cultural for masculine behaviors, and to kind of be the strong person and not admit to those weaknesses can definitely increase that stigma in the military. On an international scope, I didn't find any current evidence to suggest veterans would be in danger or shunned in other regions of the world, but historically, in America, Vietnam veterans were shunned when they returned home just because of the unpopularity of the war. And I even found an article that said Irish World War I veterans were shunned, ostracized, and even murdered as well. So some, depending on the popularity of the war and service, veterans have been mistreated culturally, but I couldn't find any evidence currently. So I want to go over some of the health disparities that are present in veterans. So socioeconomic status can be a factor for veterans, especially those with lower socioeconomic status leads to poorer health outcomes. And especially in the instance of homeless veterans, they are not taking advantage and utilizing the healthcare systems that are in place. And that could definitely lead to the poor health outcomes because they're just not taking advantage or using or aware of the access that they can have. Based on religion, I didn't find any evidence of health disparities. Race or ethnic disparities are present among veterans. Specifically, they found that African Americans or Hispanic ethnicities have received a lower quality of care. There's a large study that kind of reviewed several studies about health disparities, and some of those studies found no disparities, and some of them found a slight disparity. But it did find that in general, Caucasians did have higher quality of care and used the VA services more and had better outcomes. Gender, you definitely see there's a disparity between male and female. In veterans, males have more priority in females have lower quality of care, less utilization of health care, and worse outcomes than male veterans. Geographical location does play a big role and causes a health disparity for those veterans that are in rural areas or farther away from VA hospitals and clinics, just simply because they can't access them as easily. I think as telehealth and telemedicine increases, this could definitely lessen or even eliminate this health disparity because it would increase that access. I did find in this study about health disparities for veterans that mental health disorders lead to poor health outcomes in veterans than those without mental health disorders. And I don't know if it's because they're not seeking treatment or they're simply not in the right frame of mind to be beneficial for helping treatment, but they do have poor health outcomes. Now on to some of the biases that veterans can experience. The only bias I found was an implicit bias that Americans unconsciously associate return of a deployed veteran with unstable mental health, and that can definitely cause increased difficulty in veterans' reintegration into civilian life when people are hesitant or slightly fearful around you, even on an unconscious level. I did not find any evidence of explicit biases. On an international scale, I couldn't find any evidence to suggest health disparities would be less for veterans in other regions of the world. Just from my personal view and what I know of the world, I think those health disparities might be worse in other countries, simply because America has put a focus on trying to give equality to people and try to eliminate some of those health disparities that we might see. Granted, we're not perfect at it, but I do think we do have some large steps against those health disparities than some other countries. So I think they could be worse in other countries, but I didn't find any evidence for or against that. Here are my references about veterans and the cultural and environmental factors that they face. Thanks for listening.